Who are you?
My name is Brittany Battle, PT, DPT, graduated from Campbell University's DPT program in 2019. I'm currently working at Duke University Hospital in acute care.
Great. And why did you choose physical therapy?
Oh man, so many awesome reasons now in hindsight, but in the beginning, I grew up in a single parent home, so I would have to spend the weekends with my grandmother. My grandmother is a physical therapist assistant, and so her job was very fun, dynamic, it seemed cool. She worked at a skilled nursing facility, and so my first exposure to physical therapy came from her, and I just shadowed in high school and really liked it and continued to make it a career.
Awesome. That's really cool that your grandma had some experience.
Yeah.
What is your current role? How would you describe your current role in physical therapy?
I think my current role is multifaceted, which I think is pretty typical, I feel like, of a lot of therapists that I work with. So I have just kind of stepped over into doing a little bit of TA, so teaching assistant or lab assistant with the Duke physical therapy program. And then I work full time as a clinician. So in acute care, I can float most areas of the hospital, being emergency department, the neuro ICU, neuro step down, general medicine, oncology. So I can float any of those types of patient care areas. And then on the more career side, I am an APTA scholar. So I'm spending a lot of time learning about the APTA, how to be a leader in ways that I want to lead within the APTA. I would say also on the North Carolina side, being a part of APTA North Carolina and being a part of the exec board for our early professionals, so professionals that are anywhere from 0 to 5 years, and just kind of working with like presenting webinars or coming up with different topics that would be helpful for a new physical therapist to kind of get more breath on and understanding. So doing quite a bit.
That is a lot.
Yeah, doing quite a bit.
How do you feel like your time at Campbell shaped you personally and professionally?
Oh man, I loved my time at Campbell. Like when I look back on it, was physical therapy school hard? Absolutely. But I think Campbell itself as a program was such a great, diverse like topics, diverse wealth of knowledge that I actually felt prepared when I came out. Like I've at least heard this once, or I've seen this on a clinical, or I know that a professor has talked about some of these topics. So I felt prepared in that way. I think Campbell's big push for interprofessional education has made me such a better clinician. Like when we're having conversations in acute care where we're focusing on the total person, I feel like I can bring so much more knowledge because of the interprofessional education that I received at Campbell. So being able to think more big picture early on in school was very helpful. And understanding other people's scope of practice and how that can impact my scope of practice or things that I'm recommending for a patient. So I think Campbell really shaped me in that way. I'm really big on rural health. I'm from Rocky Mount, North Carolina. So I love that my education thought about those populations and thought about those populations first. Like, how would we do this if we didn't really have the resources? Or how would you think about if a patient doesn't make it on time to your appointments? Like, how you can help with those kind of things. And I think Campbell does a really great job at making it realistic for what you're going to get when you get out in the clinic. Like, it's not just all textbook, easy, black and white. They functioned in a lot of gray in our classes. And although I hated hearing the answer, like it depends, it definitely depended. And even now as a clinician and as a CI, I'm like, well, I find myself saying, yep, it depends. So I think Campbell did a great job at preparing physical therapists. They did an awesome job.
Do you have a highlight from your time as a PT student?
I think there's multiple different areas that I can highlight, but I think being able to have any type of patient exposure early on. So I love that a lot of our classes brought people from the community into the class. You can really touch and feel how things would feel for an actual patient, working on having an actual conversation with patients outside of your classmates because we would just kind of end scene, right? Like, and then you just kind of jump in the middle of your conversation, but really thinking about what patient education means. Am I talking too much? Am I giving too many cues? Those are really helpful as a practicing clinician now. It's something I don't even really have to think about because I got a lot of exposure with that at Campbell. And also the pro bono clinic. It was kind of cool to be a student, like actually running the clinic and seeing what that's like.
Yeah, Love the plug for the pro bono showing.
Woo!
Um, what words of encouragement could you share with someone either considering PT school or maybe even for our current Campbell students?
Keep going and keep an open mind. I think when I first came into physical therapy, I thought that I would do outpatient. And I actually did not have a clinical experience in acute care. But because I was so open to, well, a lot of our patients go through the hospital, I'm not sure what this setting looks like. I took a job at Vidant Medical Center at the time, now ECU Health, and had a great mentor there that kind of mentored me on the difference between a physical therapist working in a skilled nursing facility versus an acute care therapist. And I really liked acute care. It's dynamic, it's quick. There's so many different complexities, and you're tying a lot of those systems together. And so I think keeping an open mind, because I just continued on, I have to do outpatient because that's what I said I would do. I don't think I would be as happy as I am right now. So I think keeping an open mind and just continuing to put one foot forward. It's a learning experience. You will get the skills, and Campbell's going to do a great job preparing you. I'm sure of it.